Adalimumab is a medication used to reduce pain and swelling caused by certain types of arthritis, such as rheumatoid arthritis and psoriatic arthritis. It can also be used to treat skin disorders like plaque-type psoriasis and hidradenitis suppurativa. This medication works by blocking a protein called tumor necrosis factor, TNF, in the body's immune system, which is responsible for causing joint swelling and damage in arthritis, as well as red scaly patches in psoriasis. Adalimumab belongs to a class of drugs known as TNF blockers. In addition to arthritis and skin disorders, adalimumab is also used to treat certain bowel conditions like Crohn's disease and ulcerative colitis, as well as a certain eye disease called uveitis. The recommended dosage of adalimumab for adults with psoriasis or psoriatic arthritis is 40 mg every other week. For rheumatoid arthritis, the recommended dose is 40 mg every other week or 20 mg every week. It is usually injected under the skin. The best time to take this medication may vary, so it's important to consult with a healthcare professional for personalized advice on when to take it. Before starting to use Adalimumab-Adbm, CF, pen Psoriasis-Uveitis Strt 40 mg per 0.8 ml subcut kit inflammatory bowel agents, it's important to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist for clarification. If you are using this medication at home, make sure to learn all the preparation and usage instructions from your healthcare professional and the product package. Before using, visually inspect the product for any particles or discoloration. If you notice either of these, do not use the liquid. If you are taking this medication out of the refrigerator, let it sit at room temperature for 15 to 30 minutes before injecting. Do not warm up this medication in any other way, such as by heating in the microwave or placing it in hot water. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 centimeters, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed by your doctor. Inject this medication under the skin on the thigh or abdomen, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. If you are using this medication to treat psoriasis, hidradenitis suppurativa, Crohn's disease, ulcerative colitis, or uveitis, your doctor may prescribe a different schedule or higher dose at the start of your treatment. Make sure to carefully follow your doctor's directions for using this medication. It is important to store and discard medical supplies safely. Use this medication regularly to get the most benefit from it. To help you remember, mark the day on the calendar when you need to receive this medication. Do not increase your dose or use this drug more often or for longer than prescribed. Make sure to inform your doctor if your condition lasts or gets worse. If you experience redness, itching, pain, or swelling at the injection site, make sure to inform your doctor or pharmacist. Remember, this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you notice signs of infection while using this drug, such as a persistent sore throat, cough, fever, chills, night sweats, trouble breathing, painful or frequent urination, unusual vaginal discharge, or white patches in the mouth. If you experience any serious side effects, such as irregular heartbeat, new or worsening symptoms of heart failure, blood in the stools, mental/mood changes, severe headache, easy bruising/bleeding, leg pain/swelling, numbness or tingling of the extremities, unsteadiness, unexplained muscle weakness, difficulty with speaking/chewing/swallowing/facial movements, vision changes, joint pain, or a butterfly-shaped rash on the nose and cheeks, contact your doctor immediately. Adalimumab may rarely cause serious liver disease in people exposed to the hepatitis B virus. Your doctor may order blood tests and monitor for symptoms during treatment and for several months after your last treatment. Seek medical help immediately if you experience symptoms of liver damage, such as persistent nausea/vomiting, loss of appetite, stomach/abdominal pain, yellowing of the eyes/skin, or dark urine. If you experience very serious side effects, such as seizures or chest pain, seek medical help immediately. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you notice any other effects not listed above, be sure to contact your doctor or pharmacist. This medication can weaken your body's ability to fight off infections, which can be very serious, possibly even fatal. Make sure to tell your doctor about your medical history, especially if you have had past, recent, or current infections. Also let your doctor know if you have lived or traveled in areas where certain fungal infections are common, or if you have been near someone with tuberculosis. Your doctor will test you for tuberculosis before and during treatment with this drug. If you are diagnosed with TB, your doctor will first prescribe treatment for this to prevent a serious TB infection while using adalimumab. There is a very small risk of developing cancer due to this medication, especially in children, teens, and young adults. It is important to discuss the risks and benefits of treatment with your doctor. Be sure to tell your doctor right away if you develop symptoms such as a fever that doesn't go away, unusual lumps or growths, swollen glands, unexplained weight loss, or night sweats. Before using adalimumab, it's important to talk to your doctor or pharmacist if you have any allergies or medical conditions. This medication can make you more likely to get infections or may make current infections worse, so it's important to stay away from anyone who has an infection that may easily spread. It's also important to let your healthcare professional know that you are using adalimumab before getting any immunizations or vaccinations. Additionally, it's important to use caution with sharp objects and avoid activities that may result in injury. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits with your doctor before using this medication. Older adults may be at greater risk for infections and cancer while using this drug, so it's important to be cautious. And before having surgery, it's important to tell your doctor or dentist about all the products you use. It's important to be aware that Adalimumab-Adbm, CF, Psoriasis-Uveitis Strt 40 mg per 0.8 ml subcut kit inflammatory bowel agents may interact with other medications, which could affect how they work or increase the risk of serious side effects. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include other TNF blockers, such as etanercept, infliximab, and other drugs that weaken the immune system, such as abatacept, anakinra. Always consult with your doctor or pharmacist before taking any additional medications while using Adalimumab-Adbm, CF, Psoriasis-Uveitis Strt 40 mg per 0.8 ml subcut kit inflammatory bowel agents. If someone has taken too much Adalimumab-Adbm, CF, and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. You can call 911 for emergency assistance or contact a poison control center for guidance. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. It's important not to share this medication with anyone else. Your doctor may also want to monitor your blood and liver function while you are using this medication, so be sure to keep all of your medical appointments. If you have any questions about this, consult your doctor for more information. If you forget to take a dose, it's important to talk to your doctor or pharmacist to make sure you stay on track with your dosing schedule. Don't take a double dose to make up for the missed one. It's important to store Adalimumab-Adbm, CF, Psoriasis-Uveitis Strt 40 mg per 0.8 ml subcut kit inflammatory bowel agents in the refrigerator, but do not freeze it. Some brands may also be stored at room temperature, so be sure to ask your pharmacist or read the product package for instructions. Once it's been at room temperature, it should not be put back in the refrigerator. Keep it in the original container to protect it from light, and be sure to discard any unused portion. Remember to keep all medications away from children and pets. When it comes to getting rid of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this safely. Remember, it's important to handle and store medications properly to ensure they remain effective and safe for use. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.